Good morning. Welcome to the News Hub. I'm Rolf Winkler. When Obama administration officials delayed a central plank of the new health law requiring that big employers offer health insurance to workers, they said it was to help businesses pleading for more time. Left unsaid was a lot more. Wall Street Journal's Laura Meckler has the inside story about why the president's signature domestic initiative is behind schedule. Laura, good morning.
Good morning.
So what are the problems behind the scenes here?
Well, really, some of it is very technical, but it's very important. And that is, in order to force employers to abide by the provision in the law that requires them to offer health insurance to their employees, large employers, that is, they have to be able to report certain information to the government, to the IRS in particular. They have to be able to tell the government how many workers they have, how much they're paid, how much the premiums cost, so that they can calculate were they affordable. A lot of this information, and there has to be a way to communicate that between the companies and the government. None of those systems were set up yet. In fact, the regulations governing how they should be set up had not been issued yet. So because none of that was in place, businesses said, hey, we don't have time. We're not ready for this to go starting next year. And as a result, the administration made a decision to put that mandate off a year, buying themselves a sort of a new round of headaches around this implementation of this law.
Tell us about the individual mandate as well, also healthcare exchanges. What are the status of those parts of the health law?
Right. Well, it's important to think about this law as resting on a sort of almost three different stools. There's different pieces that together are stitched together to try to create a sense of universal coverage in this country, or to get closer to universal coverage. One piece is this employer mandate to try to shore up the employer-based system. Another piece is the individual mandate. It says all Americans must have health insurance. This is really the centerpiece of the law, and the administration says it will go forward. In order to make this work, they need to set up these healthcare exchanges. They're marketplaces where you can go and shop for insurance, compare prices, and find something. Almost, it's been compared at times to a sort of a travel website like Orbitz or something like that. It is, however, a lot more complicated than Orbitz is. It has to talk to a lot of different government agencies, get a lot of different information about you to determine whether you're eligible for a subsidy, say, to figure out what different health insurance companies will be offering for you. So that's a very complicated system. The administration says they'll be ready to go on October 1st when those marketplaces, those websites open for business, but we won't really know until that day arrives.
I got a question related. Investors may be wondering who is building all these systems, and what are the companies that are providing the systems behind the scenes to companies that have to communicate with the IRS?
You know, haven't reported on that piece of it, so I'm not sure which companies are responsible for it, but it is just really a massive job. So it's something that
I got to imagine, yeah, there's a lot of spending that's going to happen now.
Sure.
One excuse, we'll call it that, maybe that the administration gave was that they had to wait until the Supreme Court ruled last summer to allow the healthcare law to go forward, that delayed some of the initiatives, really getting some of these systems in place. Does that make sense?
Well, so in talking with the administration officials yesterday about specifically this employer mandate piece, we asked, well, why weren't you ready? They said we wanted to take more time to get this right and do it properly, so that to answer some of these concerns that business had. So we said, well, why couldn't you have done it properly and on time? And they said, well, a variety of constraints were there. They had resource limitations, and they also pointed to the Supreme Court decision that they were sort of in limbo until they found out that, in fact, this piece of the law was constitutional. It struck me as a little odd that they would have pointed to that. Obviously, you would think the administration was defending the law, that you would think they would have just sort of moved forward, assuming that it was going to be declared constitutional, which in fact it was. So I was a little bit surprised by that myself. Okay, Laura Meckler, and there's a lot more in your story on A1 today in the Journal. Thanks so much for joining us.